Distemper is highly contagious, viral disease of domestic dogs and other animals. It is incurable, often fatal, and it is a multi-systemic disease that affects the respiratory, gastrointestinal, and the central nervous systems. Distemper is caused by the canine distemper virus, or otherwise known as CDV. The disease is spread mainly by direct contact between a susceptible dog and a dog showing symptoms. Coughing and sneezing can spread the virus over short distances. As with all other diseases, clinical signs can vary. The main clinical signs are diarrhea, vomiting, a thick yellow discharge from the eyes and nose, cough, and in severe cases, seizures and neurological signs. Dogs that recover from the disease are often left with a persistent nervous musculoskeletal incoordination and twitches, otherwise known as chorea, and recurrent seizures. As with most viral infections, there is no specific treatment. Antibiotics are not effective against viruses, but do help in controlling the secondary bacterial infections that often occur with distemper. The treatment for distemper is aimed at helping reduce the intensity of signs and symptoms. This is accomplished with hospitalization to provide the patient with intensive nursing care, intravenous fluid therapy, and symptomatic treatment for the vomiting, diarrhea, cough, and others. Anti-seizure and anti-inflammatory medications may be required also in some cases. Fortunately, we have highly effective vaccines to prevent this deadly disease. These vaccines are given to puppies along with other routine vaccines. After the initial puppy vaccine boosters, additional distemper vaccine boosters should be given to adult dogs. Your veterinarian will help you determine how often your dog should receive booster vaccine. Canine distemper usually starts with several common signs of respiratory illness, including fever, cough, and eye and nasal discharge. Other symptoms include gastrointestinal signs such as vomiting, diarrhea, lack of appetite, dehydration, and weight loss. These signs are typically seen shortly after the onset of the respiratory illness. Neurological signs such as tremors of the head, neck, and or one or more legs, most often seen when a dog is asleep, stumbling, seizures, and or paralysis. These signs can accompany the respiratory and GI problems, but usually occur 1 to 3 weeks after recovery from these signs. Physical changes such as overgrowth of the foot pads, or otherwise known as the hard pad disease, can occur. Teeth abnormalities can be seen in dogs that recover from the disease. Diagnosing your dog with canine distemper is more easily done lately because of the presence of the quick tests that we're using in our veterinary clinic profession. Your veterinarian can discuss these particular tests with you in greater detail. If your dog contracts distemper, supportive care is the only treatment available. This can include IV fluids, anti-seizure medications, and medications to help control vomiting and diarrhea. Antibiotics can also be used to treat secondary bacterial infections that may be present as well. Dogs that have been diagnosed with and are recovering from distemper should be separated from other dogs for at least 2 weeks after they have stopped showing clinical signs. Preventing canine distemper, it's important to note that canine distemper is preventable with the appropriate vaccination schedule. Your puppy can be vaccinated at 6 to 8 weeks of age, and then 3 to 4 weeks until your pet is 16 to 20 weeks of age. This is then followed by booster vaccination 1 year later.